My name is Nada, I'm a pharmacist, and I'm here to present you patient case of RT. He is a 54 years old man who presents to this clinic with depression and a desire to take control of his life again. RT has depressed mood for the last 6 months due to his heart attack that was in 2015. He neither has interest in his hobbies nor likes to spend time with friends, and he has trouble concentrating at work. RT states that this season is particularly difficult for his depression, with the colder weather, holidays, and spending his birthday alone, contributing to his overall feelings of worthlessness. RT doesn't exhibit a suicidal ideation or any symptoms of bipolar disease, mania, anxiety, or insomnia. He took citalopram 2 years ago but stopped it due to erectile dysfunction and diarrhea as side effects. He would attempt quitting smoking if he could control his depression and start exercise if he could breathe better. He doesn't have severe breathlessness at rest or any signs of bronchitis, but he complains a mild shortness of breath and poor exercise tolerance when he is exercising. He had one COPD exacerbation in March last year, but that didn't need a hospitalization. RT had myocardial infarction and treated with PCI, including a drug-eluting stent. Past medical history: he has obesity, dyslipidemia, myocardial infarction, COPD, and depression. Family history: cardiovascular diseases and depression. For his social history, he smokes 1 pack per day, drinks alcohol occasionally, but he consumed more in the last 2 weeks. He's a widower because his wife passed away last year. He has allergy to adhesive, and medications that he is taking are metoprolol succinate 50 mg once daily, fluticasone 100 mg one inhalation twice daily, albuterol 2 puffs every 4 hours as needed for shortness of breath, atorvastatin 80 mg once daily, and aspirin 325 mg once daily. High priority problems including COPD and depression. Low priority problems are myocardial infarction, dyslipidemia, and obesity. For the assessment of diseases, first, for the depression, the patient has uncontrolled moderate depression by his HAM-D score of 16. The patient has experienced depression mode for 6 months, and he has constant feelings of guilt, worthlessness, and fatigues. Besides, he loses interest in his hobbies, which means he has anhedonia. In addition, he complains of having trouble with his ability to concentrate at work. All these confirm diagnosis of major depressive disorder by the DMS-5. The goal of therapy for depression is clinical improvement in symptoms with at least 50% reduction in HAM-D score. For the assessment of COPD, the patient has gold stage 2 moderate COPD as evidenced by post-bronchodilator FEV1 predicted of 52% and a ratio of FEV1 over FVC equals 63%. Also, he has symptoms of shortness of breath with poor exercise tolerance and mild wheezing. All these confirm diagnosis of COPD. RT has CAT score of 21, which is more than 10, and he had one exacerbation, so he should be allocated to treatment group B per guideline. Oxygen saturation 95%, respiratory rate 18, blood pressure 138 over 86, and normal body temperature. Goal of therapy for the COPD are to reduce symptoms such as shortness of breath and exercise intolerance, Lessen lung function reduction, prevent exacerbation, and reduce hospitalization and mortality. For the assessment of current therapy, the patient is taking fluticasone and albuterol for COPD, and those work to control his symptoms and prevent exacerbation, but still the patient is suffering from mild shortness of breath when he is exercising. For depression, the patient is taking citalopram was taking citalopram 40 milligram daily, but he stopped it due to side effects. For the plan, I recommend adding LABA, which is a long-acting beta agonist, and continue fluticasone. So start Advair, which contains LABA, and inhale corticosteroid. Advair discuss 100 milligram over 50 to be taken twice daily. Second, start sertraline 50 milligram once daily and add sildenafil, tadalafil, buspirone or bupropion if the patient experiences sexual dysfunction again. I also recommend flu vaccine and PCV13 pneumonia vaccine in March of this year or after. The rationale first per GOLD guideline, an inhaled corticosteroid combined with a LABA is more effective in improving lung function and reducing exacerbations in patients with exacerbation and moderate to very severe COPD. This comes with evidence A. For the sertraline or Zoloft, the patient had tried citalopram, which is a selective serotonin reuptake inhibitor, and it was effective for his depression, but he discontinued it due to side effect. So trying another SSRI is recommended by guideline. The 2010 American Psychiatric Association practice guideline for MDD, which is major depressive disorder, table 7 shows that adding one previous mentioning medication would help overcome sexual dysfunction. For flu vaccine per CDC, people who have medical conditions including COPD that are at risk of developing flu-related complications, so should get vaccinated annually. Regarding pneumonia vaccine, PCV13, per CDC also, adults aged 19 to 64 years old who smoke cigarettes are at risk for pneumococcal diseases and they are candidate for pneumonia vaccines. PCV13, then PPSV23 at least 12 months after. The patient already got the PPSV23 last March, so it's better to get or recommended to get PCV13 next March or after. For monitoring, starting with Zoloft, we will monitor presence of any serotonin syndrome. We will also monitor reduction in intensity of major depressive disorder or any clinical worsening and suicidal ideation. Also, we'll monitor patient uric acid, CPC, liver function, and urine output. Regarding Advair, discuss the patient may experience headache, oral candidiasis, or upper respiratory tract infection. So we want to monitor blood pressure and any improvement or maintenance in COPD symptoms and check bone mass index at baseline and periodically. Patient education including encourage the patient to stop smoking because this is recommended by both COPD and and dyslipidemia guidelines. Also consider weight loss because the patient is overweight with a body mass index of 25.1. Regarding adverse discuss, the patient should rinse his mouth thoroughly after each use to avoid getting oral candidiasis. And we want to encourage the patient to be adherent to his medication. The patient should follow up with him for weeks for reassessment. Thank you.